Hello, everybody. Today we have a great guest, Carri Chandler, the Vice President of the St. Elizabeth Foundation. Carri, you do so much with a great organization as St. Elizabeth, and thanks for giving us a few minutes of your time today.
Oh, thank you, Kris. Thanks for having me.
Absolutely. Well, of course, St. Elizabeth, one of the key leaders of an organization in this region for health and everything else around, gosh, the list doesn't end. But one of the great organizations within St. Elizabeth is the foundation and supporting the great work that's done. So, but many people may not know about the foundation and what it does. So maybe you could give us an idea of what that's all about.
Absolutely, I'd love to. So St. Elizabeth Foundation is actually a department of St. Elizabeth. So we are not a separate, 501c3. But what we do is we connect our generous community with programs and projects within St. Elizabeth that truly enhance the care that everyone receives. So, many times that's financial. We have a Samaritan Society that people can give up to $1,000 annually for 10 years. It's that kind of commitment. And it truly helps enhance the care that our community receives.
It's what a great organization. And then, of course, it really amplifies the work that St. Elizabeth would do without the foundation, right? So it's just
Absolutely.
Really one of the best things over the past couple of years we've been watching is this great initiative from St. Elizabeth with the cancer care facility coming up on the campus in Edgewood. Give us an update on where that is, but also maybe go back to the roots of it as to the why about what is this great project St. Elizabeth's been starting?
Well, unfortunately, cancer is just pervasive, on a national scale, when you're talking about, least incident of cancer to highest incident of cancer, we are number 50, Kentucky just has it's devastating, truly. So St. Elizabeth decided to address this. Lung cancer in particular is a huge killer, unfortunately. And so we are building a 250,000 square foot cancer center on the Edgewood campus. Just an incredible facility. It's going to open its doors October 1st. This was a $140 million project that was approved by our Board of Trustees. And the foundation was asked to raise at least $35 million to support this project. So we've been actively fundraising for the last 2 years or so. And right now, I'm pleased to say we're at a little over $32 million raised, which is very exciting. Yes, absolutely. And that's truly, and thanks to our very, very generous community. So
when this, in October, when this great, the doors are going to open and this great additional ability for serving our community opens, what does that look different? And how does that look different in October of 2020 compared to not having this facility? What is the gap that this fills for the community?
Well, truly, the focus of this center is going to be on prevention. Okay, so while we're certainly treating, and the treatment will be entirely enhanced. Comparatively, what this center can bring to what we have now, unfortunately, the numbers are just so high. We have people that are, receiving infusions and crowded space and that sort of thing. Of course, COVID has a whole nother layer of complexity onto that. But this will be just, the treatment will be so enhanced. But truly, it's the prevention. So this is a center for everyone, not just people who have the unfortunate diagnosis of cancer. Okay, so one thing that we're doing right now that is making a huge difference are lung CT scans. And so this is essentially, as mammography is for breast cancer, the lung CT is for lung cancer.
I see.
So, yes. So there are many people who are receiving this right now. And unfortunately, let me back up. Lung cancer is one of those cancers, unfortunately, that has relatively no symptoms, okay? So unless you're a stage 3 or a stage 4, it's not presenting itself. But by the time you get to stage 3 or stage 4, it's typically, typically you're buying some time. In rare cases, but the percentage of survival is unfortunately very low. But what these lung CT scans do is they catch cancer much earlier. So right now, we are catching cancer 1 in every 54 scans. So at this point, this is stage 1 or stage 2, it's able to be resected. There's a surgery that goes along with it, and people can live normal, healthy lives. So truly, with this is one program. This is just one program within the center that's already making a huge difference.
Well, and I think we're going to have a quick video of Dr. Doug Flora, who's going to maybe walk through the facility with us. And I've heard Dr. Flora speak a few times, and I think every time I've heard him speak, I walk away either with a tear in my eye or an enhanced awareness and appreciation for the work that the community does, doctors and nurses do for cancer care. But we'll share that here and give it a chance for people to see the facility.
The St. Elizabeth Cancer Center, opened to patients in October 2020, is well on its way to providing the most advanced and innovative care for our region. Join me on a virtual tour to see the areas we're developing to fight cancer through education, screening, and cutting-edge treatment. Starting at the entrance drop-off, patients and guests will safely arrive and exit the Cancer Center through a covered and protected space. The entrance leads into the main lobby. Bathed in a warm, uplifting sunlight, this soaring 2-story glass enclosed area fosters a calming environment for patients, families, visitors, and associates. Down the hall, you can find the doTERRA Center for Integrative Oncology. One area in Integrative Oncology is our state-of-the-art demonstration kitchen. From cooking classes to meal planning tips and customized grocery lists, patients benefit from a unique suite of interactive nutrition services offered here by our partners at Cancer Support Community. In a quiet corner of the building off the main lobby, the meditation room is a sanctuary for patients and families to reflect, pray, or relax before or after treatments or appointments. Situated for access from many areas in the center, the garden courtyard is expansive at 5,500 square feet. Winding pathways lead visitors through art-filled therapeutic gardens where patients and families can enjoy moments of peace. Located on level 1, the boutique offers a chic retail space with products, support, and specialty gifts to aid in the cancer journey. Our goal is to help relieve some of the stress and anxiety related to appearance so patients can focus on their healing. With a prominent view from the 2-story main lobby and direct access via the grand staircase, Breast Health offers diagnostic testing and serves as a hub for the St. Elizabeth Multidisciplinary Breast Health Team. Level 2 is home to many clinics, including thoracic surgery, which provides a collaborative, multidisciplinary, and evidence-based approach to the diagnosis and management of lung cancers, esophageal cancers, and other cancers in the chest. The Level 5 auditorium serves as the Cancer Center's tumor board headquarters, the home for multidisciplinary presentations and discussions that explore issues and sharpen treatment recommendations for unique or complex cases. St. Elizabeth is right here with a leading national cancer center. We look forward to working together to reduce our area's cancer rates and lead Northern Kentucky to become one of the healthiest communities in America.
And just a note about Dr. Flora. I mean, I am truly blessed to work as close with him as I have. He's just an absolutely remarkable individual. I mean, smarter and brighter than you can possibly imagine, and then also just so incredibly caring. Cancer is just, it's so personal to him. He lost his mother as a young boy to cancer, and so he knows the devastating effect. And within the last 3 years that I've known him, he himself contracted cancer and kidney cancer, and so he speaks openly about it. So he's walked the walk. So not only has he been on the physician side, he's already been on the patient side, and so this is a very patient-centered facility that he's created.
Well, we're very fortunate that he's been brought in to lead this effort, and of course, just adds to the whole team at St. Elizabeth. And it's going to be an exciting time to celebrate in October when this is open. And who knows, maybe eventually we stop being at the top of the list for cancer in Kentucky and Northern Kentucky. I think everybody would be very happy if that were the case.
I think that's the goal.
So, Carri, one of the other things you've been dealing with is COVID and the foundation. So share with us some of the things that the foundation has been dealing with that as well.
Well, it's interesting, Kris, because, we're all about connections, so we have, the foundation is made up of committees, and of course we put on events and those types of things. And of course, COVID has thrown a wrench into everyone's plans with those. But one truly just amazing bright spot in this whole thing was the generosity of our community and how they came out in support of our healthcare workers. Certainly, not just St. Elizabeth, but, region wide. It's just truly been incredible. And so one need that we saw, we had a lot of people calling us saying, what can we do? What can we do for you? And certainly, masks were a big deal. We had over 7,000 masks made for St. Elizabeth, which was just incredible. People were calling, and it was kind of a twofold, because they were supporting restaurants, but they were also supporting our associates, and they were calling and saying, we had all of our COVID patients are in Fort Thomas, and so one phone call might be, hey, I want to feed a whole entire shift at Fort Thomas, and so we had close to 300 of those calls, and so. So the foundation was facilitating a lot of the community generosity and still remaining, to be that link to the community, to the associates. And so it was just really exciting. I remember I asked Garen Colvin, our president, I said, in the midst of all of this, I said, have you ever seen our community come out and in support of St. Elizabeth like this before? And Garen's been there 37 years. And he said, I have just never seen this. This is just, it's incredible. And it was so heartwarming. And, in a part where everyone was just kind of distance, it was like a warm hug, for the entire system. So it was just very meaningful, and not something we'll soon forget.
And in addition to that, I think you also raised actual dollars, right? I mean, towards your associate share.
We did. We have an associate crisis fund. Of course, our associates, they were also, having, I think one really important thing to note is that everyone stayed employed the entire time. We had no layoffs. We had nothing. It was truly the leadership, I have to say, of the system is incredible. The leadership both by Garen Colvin and Gary Blank, and then also by Lori Ritchie Baldwin, who's our CFO. Just to manage through this entire issue is just incredible. I mean, truly, there were layoffs and things happening everywhere, and they managed to keep everyone together, which was really meaningful. So our associates were going through, obviously, issues themselves, perhaps a spouse, laid off, childcare issues, elder care issues, all these, different things that happen. And so we raised about a little over $600,000 for our associate crisis fund. And so associates could actually apply to this fund to gain some, short-term support. So
that's wonderful.
So very meaningful.
Well, it's amazing when you talk about what Northern Kentucky does best is come together, help each other out in a time of need, as well as aspire to be healthier, be more connected, and support each other. So I think you've got to have leadership, and you guys have done a great job of that at the foundation and the hospital. And again, just some great work being done.
Thank you. Yeah, you're exactly right. In times of crisis, Northern Kentucky comes together. And it's a beautiful thing.
Amen. Carri, thanks so much for your time. Got some great information here for the public. And of course, I always want to say thanks to you and the entire team at St. Elizabeth. Great leadership and great public health advocates, and just keeping this community as healthy as possible.
Oh, thank you, Kris.
You bet.